So to begin, the conference was warmly opened by our Minister for Health here in Ireland, Stephen Donnelly, who discussed how the current pandemic has highlighted the crucial role and the need for good research, to which he commented that Irish researchers are delivering, but also that we need to tackle the infodemic in our daily lives and really to help us be able to decipher fact from fiction. We kicked off our first session, which was looking at understanding health misinformation and disinformation, and we met with three truly exceptional speakers. Sir Ian Chalmers took us on a historical, provocative journey, in which he invited us to join him in asking the question, can unaccountable research ethics committees be trusted to help protect patients and the public? And in answering this, he reflected at the huge issue of research waste, which was certainly a theme that was continued throughout the three sessions. We looked at how historically needless patient morbidity and mortality has resulted from the conduct of research within a contextual void, ignoring available evidence and not considering evidence synthesis when approving research. Sir Chalmers really wanted to use this platform to discuss concerns he's held for over 52 years that flawed ethical analyses have underpinned the need to reduce uncertainties about the effects of treatments. He approached this talk from the perspective of a patient and as a citizen, but informed by his work as a healthcare professional through the years. And he now calls on the next generation of researchers and healthcare professionals to continue this discussion and hopefully make improvements in this area. And while he finished on a note of positive change, providing an action plan in how to make this better and a lovely symbol of the future in his granddaughter, Millie Chalmers. Sir Chalmers reflected on the excellent work by Dr. Andy Oxman in Norway on a now global initiative called the Informed Health Choices Project. And this nicely led our way into the talk by Professor Declan Devan, who used this resource to show us how to disentangle health claims. What are the warning signs here? And as an informed public, what should we look out for? While we might think that the concept of an infodemic is a new concept, Declan reflected on Jonathan Swift's phrase from the 1700s, falsehood flies and truth comes limping after it. Declan worked with the event's PPI contributors, Anne Daly and Deirdre McLaughlin, focusing on four key concepts, which he showed us as a toolkit for breaking down bogus health claims. Our third speaker then asked us to think about what is it about this type of information that makes it successful, or is it actually something in our own cognition? Dr. Gillian Murphy showed us the who, the when, the what, and the how of this, and used patches of weeds, causing us all to wake up and look at our ability to slow down and review our gut response to a fact. New terms for me included truthiness and illusory truth, I hope I'm saying that right, and her examples of human behaviour around remembering events or facts from real life, which was really interesting. Since Gillian's talk, national media in Ireland here has picked up on many of the facets, including how we know so little about the downstream impact of fake news and how we need to develop people's cognitive skills for processing information. Our afternoon session focused on assessing the credibility of health claims, and I can safely say there was no mincing of words here. We met with Professor Edzard Ernst, who looked at research into so-called alternative medicine. And he uses this acronym, or SCAM, to describe most of the alternative therapies discussed. In the Q&A, we learned that Professor Ernst started out years ago actually as an advocate for homeopathy. And through the best research methods possible, he discovered by working from the inside how flawed this research area actually is. I personally was shocked to learn that 25% of the UK population uses some aspect of SCAM, and this can be higher in certain patient groups. And he showed us the real detrimental effects that these so-called alternative medicines can have on human health. He explored alternative medicine research more broadly, looking at all aspects, including methodology, funding, expertise, and the motivations behind the research who were looking at this. Laid bare the underpinning major shortcomings around so-called alternative medicine research was presented, and how alternative medicines are having a free ride, given that they have little to no underpinning evidence about their effects. The afternoon session then brought us a real tour de force, where PPI contributor met GP, or rather, two friends sat down and had an honest chat. Margaret McCartney and Deirdre McLaughlin discussed stakeholder collaboration in finding the truth in conflicting science. It became clear that Deirdre is a true PPI champion who talked about the HRB PPI Ignite initiative and how this group in Galway has acted as a catalyst for her in PPI research, as this ultimately brings a lived experience to the table, including shaping how this conference came into being. I hope she doesn't mind me describing her as a powerhouse of passion and drive for PPI research that was ultimately a most inspiring conversation. Deirdre explained that PPI is simply a conversation, and it can shape the conduct of research for the better, to get more meaningful outcomes. Deirdre and Margaret talked about the inclusivity in research across race, gender, and background. Deirdre's advice to anyone and everyone in the area of misinformation was, be vigilant and think critically. Social media is testing us, and we need to equip ourselves. But as she questions, we take charge of so many aspects of our lives, so why not this? This afternoon, we explored responsibility and integrity in reporting health research with 3 distinguished speakers. Our colleague, Dr. David Moher from Canada, spoke about promoting trustworthiness in research and asked the question, do we need to modify current perverse incentives and rewards when assessing researchers? David set this scene by outlining the academic criteria for promotion and tenure in the biomedical sciences area, and the fact that publications are seen as a currency for research, and that this could even drive someone to include their publications listing as a QR code in their tombstone is one that will stay with me. This publish or perish attitude to publications can bring with it significant issues in the trustworthiness and integrity of research, including the rise of fake or predatory journals. David spoke about how the COVID-19 research pandemic research wasn't an exception, and how this research also fell foul to these issues, despite initiatives being set up to help combat this. David talked us through the Hong Kong principles, which try to foster research integrity and provide real guidance in this area. And this was only just published this summer. And in his talk, he covered the 5 principles which he outlined for us, which included valuing accurate and transparent reporting of research regardless of the results. And I know that many of us would be keen to read that paper. We then met with another fantastic double act in this conference. Dr. Maura Heine and Professor Anita Maguire looked at developing a culture of good research practice, looking at both national and international examples. Dr. Heine outlined that she considers included in the topic of research integrity, seeing it as across all steps in research, from the conception and design right through to dissemination. And this echoed many of the points that Dr. Moore had previously raised. She explored the urgent threats we face when it comes to developing a positive culture, but also the range of EU-funded projects which are tackling this area and the global initiatives being implemented. Anita then explored the Irish perspective, looking at the Research Integrity National Forum in Ireland since 2015. She spoke about the training in this area, for which over 11,000 people have undertaken to date. And important to note that this is researchers from all levels, from both junior researchers right up to principal investigators. Anita also spoke how UCC, where she is based, have taken a proactive approach to embed these principles locally, with an impressive account of how staff and students have come together meaningfully to engage in tackling this. Certainly something I think that all institutions nationally can aspire to. Our penultimate speaker this afternoon was Mark Little, who explored flattening the curve of misinformation and strategies for success in a world of alternative facts. Mark explored the current infodemic and also the campaigns of deception that feed into this, and how we need to flatten the other curve. He reflected on the way we share information 30 years ago in his early days of RTE, our national broadcaster here in Ireland. Protests on the streets of Tehran were a light bulb moment for him, as he saw how the centre of the story was moving to the younger generation, or rather anyone with a phone. And this led him to start Storyful, the first social media news agency. Now Mark is leading Kinsen, which supports editors with machine learning and AI against the second wave of disinformation. He describes the spread of disinformation in the same language used in the pandemic, such as in super spreader events where social media influencers share or retweet disinformation. And I found this a really impactful way to signal the seriousness of the infodemic. He ended on, be first, be clear and be kind. And like all of our speakers had said, seek reliable, evidence-based information before you decide. Our last speaker this evening was Dr. Eileen Collety, looking at understanding and countering healthcare disinformation. Eileen started off with a really impressive account of the projects that she has worked in DCU, directly working to counter healthcare information. She talked about scientific distortions in the media, the energy put into correcting this, and how COVID-19 research has put all of this into overdrive. Eileen provided an overview of the factors as to why some people are more susceptible to disinformation, which was also echoed in Dr. Murphy's earlier talk, in particular around this aspect of repeated exposure to false claims. She highlighted another less well-researched area in that we know so little about the motivations for why people share disinformation, but alluded to some of the reasons for this, including that some feel it's a civic duty playing a role here. Like all speakers, Eileen included practical, positive, evidence-based approaches and responses, which we can all use in countering this infodemic. So I want to thank you for those that have hung around to hear that synopsis. I'm really pleased to have taken part in this conference, and thank you all for listening.